Namaste everyone, I'm back with my another YouTube video. This is Emma Medical College student. Today I'm going to teach you about pulse. It is very basic knowledge where students should know it because it is present in their physiology practicals and it is also benefit during their clinical postings. So it is very basic knowledge. So before knowing that, please like and subscribe my channel for more videos by pressing the bell icon. So now, what do you mean by pulse? First of all, how you will define a pulse? The rhythmic dilation of an artery that results from beating of the heart is called as pulse. How you will examine a pulse then? How you can feel a pulse of a patient? It is by using mainly the three fingers that are the index finger, which is said as first finger, middle finger and ring finger. So by the use of these three fingers, you are going to examine the pulse of a patient. And the arm, it is pronated to relax the fascia at the cuboidal fossa. Why it is done so? So to avoid the stretch of the brachial artery. So in the next figure, you can see how a doctor is examining the pulse of a patient by using his three fingers, denoting the first finger, that is the index finger, as obliterating finger, middle finger as palpating finger, and ring finger as the emptying finger. So by the use of these three fingers, you can examine the pulse of a patient. Now how to examine the pulse clearly? See, always remember, if you want to examine the right hand pulse of a patient, then be to his right side and then examine the pulse. Don't be to the left side of the patient and start examining the right hand, because you will not be able to feel the pulse properly. That's why. So if you are examining the left hand pulse of a patient, then be to his left side and then examine the pulse. I hope you are getting. So how to define or comment upon characteristics of pulse? How you can define a pulse in various manners. So that are the rhythm, rate, volume, special characters, force, tension, equality on both sides, condition of the vessel wall, other arterial pulsations. So these are the other characters by which you can define the pulse of a patient, isn't it? Now, first we will see about rhythm. Rhythm of a pulse, it may be during regular rhythm or irregular rhythm. See, if you examine the pulse of a patient, then the first character you will see is for the rhythm. And rhythm can be regular or irregular. Now, what are the causes of irregular rhythm? Irregular rhythm, also called as arrhythmia, isn't it? Now, what are the causes for it? That are coronary artery disease, electrolyte imbalance in the blood such as sodium or potassium, changes in our heart muscle, injury from a heart attack, and if the person, if he uses the things like caffeine, alcohol, and if he is stressed, causes the temporary arrhythmias. So these are the causes for the irregular rhythm. Now coming to the next character, that is the rate. Normally the heart rate, you know it, I hope so. Normally the heart rate is 60 to 100 beats per minute. Now, rate has come to the two characters, that is the tachycardia and bradycardia. Okay, heart rate more than 100 beats per minute causes tachycardia, and bradycardia is where the heart rate becomes less than 60 beats per minute. So tachycardia, bradycardia. First we will see what are the causes of the tachycardia. So mainly the three causes, that is the physiological cause, pathological cause, pharmacological cause. Okay. So in the physiological cause, it includes during the exercise, during heavy workout, gym workouts, exercise and emotions, when the person is too stressed or is too excited conditions. So these are the physiological conditions where a person can face the tachycardia, and Pathological conditions like fever, shock, thyrotoxicosis, heart failure, anemia, hypovolemia. So these are the pathological conditions where you can find the tachycardia. Now pharmacological conditions. If the person uses drugs like sympathomimetics such as adrenaline, ephedrine, amphetamine, and parasympathetics such as atropine. So by the use of these drugs also, there may be tachycardia in the person. These pharmacological drugs will be more familiar in your second year MBBS. So use of sympathomimetics and parasympatholytics also causes the tachycardia. So first you have seen the heart rate, normal heart rate. In that two types, that is the tachycardia and bradycardia, and causes of tachycardia in the three forms: physiological, pathological and pharmacological. In the same way it goes for the next bradycardia as well. So physiological causes are in the athletes, and whenever the person is in the sound deep sleep, also you can find the bradycardia. And pathological causes are like obstructive jaundice, hypothyroidism, intracranial hypertension, where there is increase in the intracranial pressure, right? And pharmacologically, by the use of drugs called calcium channel blockers and beta blockers, also bradycardia occurs. I hope you're getting. So first we have see the rhythm, causes for irregular rhythm. Next, rate, normal heart rate, tachycardia, bradycardia, physiological, pathological, pharmacological causes for both tachycardia and bradycardia. So remember the conditions, it is very important. Okay. Next, coming to the next character of the pulse, volume, which is related to the pulse pressure. Pulse pressure is the difference between the systolic and the diastolic blood pressure, and it will be normally between the 20 to 60 mmHg. Okay. And what are the causes of the small pulse volume? What are the reasons and causes for weak pulse? These are pulmonary hypertension, myocardial infarction, hypovolemia, heart failure, constrictive pericarditis and mitral valve stenosis. These are the causes for the small pulse volume, for a weak pulse. Now what about the causes of a high pulse volume then? It may be due to the increased systolic blood pressure or decreased diastolic blood pressure. Now why does this increased systemic blood pressure takes place, which can be also due to the ventricular contraction? It may be due to the bradycardia, aortic incompetence and thyrotoxicosis. And what are the causes of this decreased diastolic blood pressure? That is nothing but peripheral resistance. So vasodilator drug, pregnancy, anemia, hypoxia, liver cirrhosis, it may cause the decreased diastolic blood pressure. Now what are the causes of the variable pulse volume then? I hope you are getting. In the first we saw what is pulse pressure. We saw what are the causes for a weak pulse, for a small pulse volume. In the next slide we saw what are the causes for the high pulse volume. And now we are seeing what are the causes of the variable pulse volume. See the difference, isn't it? So causes of variable pulse volume are AF, that is the atrial fibrillation, variable heart block and pulsus alternans. Now coming to the next characteristic, force of a pulse. It is defined as the pressure needed to occlude the pulse. And what is the significance? It estimates the systolic blood pressure. Now coming to the tension. Tension is nothing but the pressure needed to feel the pulsations. What is the significance of the tension then? It estimates the diastolic blood pressure. So next, coming to the special characters. It is very important, my dear friends, what are the special characters of the pulse, and all of them have differences between them. The name they pronounce as similar, but they're having differences. We will know in the next coming slides. Okay, so what are the special characteristics of a pulse? Pulsus alternans, pulsus bisvarians, pulse deficit, pulsus paradoxus, water hammer pulse, and plateau pulse. So these are the special characteristics of a pulse. Let's see what is the normal pulse. How does it look like? How it will be? A normal pulse will be having gradual ascent and gradual descent with a normal pulse volume. See in the coming slides, these figures are very important. So keenly observe it in the normal pulse, the waves are going, and in the B, hypokinetic weak pulse, C, hyperkinetic bounding pulse, D, bigeminal pulse, E, pulsus alternans, F, water hammer pulse, which is the collapsing pulse, and G, pulsus bisvarians. So all of them are having differences in the pattern. I hope you are understanding and you are observing the figure, isn't it? And in the next figure also, in systemic arterial pulse, how it will be: normal pulse, hyperkinetic pulse, reduced pulse, pulsus alternans, pulsus bigeminus, and pulsus paradoxus. So keep these figures in your mind. So next, coming to the plateau pulse. Keep that figures in your mind. By that we will study now. Plateau pulse, which is also called as pulsus tardus et parvus, isn't it? So what is that? In plateau pulse, what happens? There will be slow ascent and slow descent with small pulse volume. What was happening in the normal pulse? You can see there was gradual ascent and gradual descent with normal pulse volume. See here, isn't it? And in the plateau pulse, there will be slow ascent and slow descent with small pulse volume. What are the causes for this? That are the aortic stenosis, heart failure, hypovolemia, myocardial infarction, pulmonary hypertension, and mitral valve stenosis. These conditions you need to remember, my dear friends. And next, coming to the water hammer pulse. What is the difference between plateau pulse and water hammer pulse now? There will be sharp sudden ascent and sudden descent with big volume. See here. In water hammer pulse, in the F bit, there is sudden onset and sudden descent, isn't it? Sudden ascent and sudden descent with the big volume. And causes of water hammer pulses are thyrotoxicosis, bradycardia, hypoxia, anemia, pregnancy, liver cirrhosis, and sepsis. So these are the conditions for the water hammer pulse. I think you are getting the differences between normal pulse, plateau pulse, and water hammer pulse. And next we come to the pulsus bisvarians. It has two palpable peaks. Pulse with the two palpable peaks is the pulsus bisvarians, isn't it? The first peak, which is also called as percussion wave, it is also called as pulsus bisvarians. Bi means two. There will be two palpable peaks. The first peak will be percussion wave. Second peak will be tidal wave. First peak, why it happens? It is due to the transmission of the pressure of isometric ventricular contraction through the closed aortic valve to the aortic blood in the early systole. And why does the second peak occurs? It is due to the recoil of the vascular bed. Now how you can clinically detect the pulsus bisvarians then? So it is detected in the large arteries as brachial artery. What are the causes for it? It may be due to the aortic lesions, mainly the double aortic lesion and hypertrophic obstructive cardiomyopathy as well. So coming to the pulses paradoxes. What happens during normal inspiration? The pulse volume decreases. Why it decreases? Because decrease in the systemic blood pressure, which will be less than 10 mmHg. And why there will be decrease in systemic blood pressure? Because there is decrease in the ventricular contraction, and it is mainly due to the two main factors. First factor is that there will be more negative intrathoracic pressure, which interferes with the left ventricular contraction, and due to which the lung accommodates more blood during the inspiration. So this was the normal mechanism. What happens in the pulses paradoxes we will see in the next slide. Pulses paradoxes is considered as a exaggeration of the normal. This was the normal mechanism. In pulses paradoxes, what happens? Instead of normal decrease in systemic blood pressure less than 10 mmHg, here in pulses paradoxes there will be decrease in systemic blood pressure more than 10 mmHg during inspiration. That blue stars you can see on the slide, I think so, that you should remember for the pulses paradoxes. Just if you say in the pulses paradoxes, what happens? There will be decrease in the systemic blood pressure more than 10 mmHg during the inspiration. If you say this, it is enough. Then what are the causes for this pulses paradoxes? Pericardial effusion, constrictive pericarditis, and increase in the lung capacitance as in the chronic obstructive pulmonary disease and pulmonary embolism. These conditions you need to remember, my dear friends. Now how you will clinically detect the pulses paradoxes then? It is by the palpitation of the pulse volume of femoral artery during regular respiration and also deep inspiration, and by the use of sphygmomanometer by measuring the systemic blood pressure during regular respiration or deep inspiration. So in this way you can clinically detect the pulses paradoxes, isn't it? Now coming to the pulses alternans. Here what happens? The strong beat is followed by the weak beat, which are in equidistance. What are the causes for this pulses alternans? It is mainly due to the left ventricular failure. Why? Because there will be alternation between the strong and weak contractions, which will lead to the contractions of all cardiac muscle fibers, and there will be prolonged recovery time of the damaged myocardium. Now, how you can clinically detect it? That is by palpation of the pulse, then measuring the blood pressure, and there will be increase of cuff pressure above systolic blood pressure. And then what you will do? Very gradually release the pressure to feel the pulse. Then remove the cuff. Okay? And then recount the pulse. If it is doubled, you get the pulses alternans. By palpation of the pulse, you will measure the blood pressure, and by increasing the cuff pressure above systemic blood pressure, and then you will gradually release the pulse to feel the pulse and remove the cuff, recount the pulse. If it is doubled, you get the pulses alternans. In pulses bigeminus, there will be strong beat followed by the weak beat. Then there will be a pause. What are the causes of pulses bigeminus? Hypokalemia, digitalized toxicity, myocardial infarction. These are the causes for the pulses bigeminus. What is pulse deficit then? Pulse deficit where the apical pulse will be greater than the radial pulse. What is apical pulse then? Apical pulse is measure of cardiac function that is completed by placing a stethoscope at the apex of the heart and counting for 1 minute. Where you can find the apex of the heart, my dear friends? See in the next figure. See between the ribs, third and fourth, in that green circle, that is the apical pulse in case of infant or young child. And between the ribs of fourth and fifth ribs, you can see the blue circle, encircle circle, that is the apical pulse in case of the adult. Now coming to the radiofemoral delay. What is that? Delayed pulse in femoral artery, then in radial artery. It is associated with decrease in blood pressure in femoral artery, then the radial artery. Okay, for example, it happens in aortic coarctation, where there will be abnormalities in the development of the aorta prior to the birth. It is seen in the people having congenital disorders like a Turner syndrome. Next, equality of the pulse volume. What is that? Equality. Equality means both, something having both. Equality of pulse volume. In this, you should palpate both the radial arteries at the same time. Both the radial arteries means right and left, both hands radial arteries. There will be unequal pulse volume in cases such as aortic coarctation, dissecting aorta involving the left subclavian, aortic aneurysm and subclavian aneurysm, thrombosis and embolism. So in equality of the pulse volume, you are going to examine the pulse of both the hands, right and left, both. So if there is any inequality in the pulse of the volume, then it may be due to some conditions like aortic arch coarctation, dissecting aorta, and aortic aneurysm, subclavian aneurysm, thrombosis and embolism. See in the next figure, this is the radial pulse. How a person is detecting the radial pulse? It is felt on the wrist, just under the thumb. In that place, you can feel the radial pulse. And apical pulse, as I told you, it will be felt in the apex of the heart. Isn't it? Now note one important point to be said. In Mockenberg arteriosclerosis, there is calcification of the muscular arteries. This is detected radiologically. In Mockenberg arteriosclerosis, there will be calcification of the muscular arteries. And how you can detect it is by the radiologically you can detect it. What happens in arteriosclerosis is the vessel becomes cord-like when you feel it. So normally vessel cannot be felt, and these are the conditions of the vessels where you can feel the pulse. In Mockenberg arteriosclerosis and in the atherosclerosis, these are the conditions. So other pulses are carotid pulse, brachial pulse, dorsalis pedis pulse, posterior tibial pulse, femoral artery pulse and popliteal artery pulse. In the next figure you can see it. Femoral pulse, popliteal pulse, posterior tibial pulse, dorsalis pedis pulse. You can find it where you can feel the different pulse other than the radial pulse and apical pulse. There are the 6 other pulses as well: carotid, brachial, dorsalis pedis, posterior tibial, femoral artery, popliteal artery pulses. So again we will revise once again. I told you about pulse, definition, how you will examine by using the 3 fingers, index, middle and ring finger. Then the characteristics of the pulse, how you will define a pulse in the various ways, rhythm, rate, volume, special characters, force, tension, equality on both the sides, condition of the vessel wall. In condition we have saw the two conditions, Mockenberg and atherosclerosis, isn't it? And other arterial pulsations also we saw it. So in rhythm there will be two types, regular rhythm, irregular rhythm. What are the causes of the irregular rhythm? And rate, normal heart rate, tachycardia, bradycardia, their physiological, pathological and pharmacological conditions. Next, volume, how it is related to the pulse pressure, what is pulse pressure, what are the causes of weak pulse. Then decreased diastolic blood pressure causes, increased systolic blood pressure causes, then variable pulse volume causes, then force, tension, their significances, then special characters, pulses alternance, pulses bisvariance, pulses deficit, pulses paradoxus, water hammer pulse, plateau pulse, and the differences between all these special characters. In normal pulse there was the gradual ascent and gradual descent with normal pulse volume. And remember these diagrams so you can differentiate the special characters of a pulse, isn't it? So you have also see how to clinically detect them. You saw where you can find the apical pulse, radiofemoral delay, and next equality of the pulse volume, where you have to see the pulse of both the hands of a patient, radial pulse, then the conditions, then other pulses like carotid pulse, brachial pulse, dorsalis pedis pulse, posterior tibial pulse, femoral artery pulse and popliteal artery pulse. So I hope you have understand something about the pulse. Thank you for watching my video. Again, please like and subscribe my channel by pressing the bell icon for more videos. Thank you.